Have you gone to the doctor and been seen by a physician assistant instead of an MD before? Well, physician assistants are able to diagnose illnesses, prescribe medications, and manage treatment plans. Now, a proposed South Carolina bill aims to give the position more independent practicing power. Fox Carolina's Carrie Beal is joining us with what this could mean for you, the patient.
Currently, physician assistants in the Palmetto State can only work under the supervision of a doctor. But this proposed piece of legislation would give certain PAs more power. Senate Bill 553 would allow physician assistants with at least 6,000 hours to practice without the supervision of a doctor. Advocates say this would help address the doctor shortage happening across the country. According to the Kaiser Health Foundation, about 2 million people in South Carolina live in areas with a healthcare professional shortage.
And when we ask patients to drive an hour, 2 hours, 3 hours, 4 hours, however far, there's financial resources, there are just the resources of having a car. We have lack of public transportation from rural areas to urban areas. So again, I think this is going to be huge for specialty care.
A lot of rural clinics will only have one physician and one PA. If that physician suddenly falls ill or decides to retire, that PA can't work any longer unless they find another supervising physician.
Both of those people were physician assistants. Jennifer Marshall says this law would allow the physician assistant to continue working at the practice without the doctor, but not everyone is in support of the bill. Physicians for Patient Protection says doctors usually have to complete 15,000 hours of clinical work before they get their license. They believe 6,000 hours for a PA is not enough and could put patients at risk.
And it's because this has been determined that this is the minimum amount of training and experience that is safe for doctors to be allowed to practice medicine. So to me, it doesn't really make sense that you're saying a doctor has to complete this minimum or they're not safe to practice medicine. But now we're going to allow a different professional to do that same amount of that same type of care, but in half as many hours or potentially even less.
Dr. Bernard says there are alternative solutions to the doctor shortage, saying there is limited government funding for medical students after they graduate and start looking for resident opportunities. This is typically when they work in a hospital setting. We'll have more on how this group would tackle the doctor shortage on our website at foxcarolina.com. The bill has currently been referred to the Committee of Medical Affairs. We will continue to keep you updated on its progress. For now, Carrie Beal, Fox Carolina News.